Okay, so this presentation is a two-part presentation where we'll discuss confidentiality as regards to clinical practice as a caregiver. We'll also discuss an entity called advanced directives. So now, by way of introduction, confidentiality means keeping what is supposed to be kept private. That's the simplest definition I can give of it. And it means not disclosing or telling other people who do not have a right to know information about your patients. It entails that you not share information with others who are outside of the patient's healthcare team. In this case, the physician, the nurses, the social workers, the physiotherapists, and every other person that takes care of your patient. And you would, as the home caregiver or as the caregiver, come to know intimate details about patient's body and lives. And it's important that you take every step that you can to protect this privileged classified information. You have an ethical and legal responsibility for protecting the privacy of your patients. A good rule of thumb to use before sharing any information with members that are outside of the healthcare team is to ask yourself this following question. Does this patient have a right to know this information? Did your patient give you permission to share information with this person? That could be maybe doctor, as the patient giving permission to share such an information with the doctor. Then would sharing this information with this said person be harmful to your patient in any way? Then if roles were reversed and you happen to be the patient, would you want someone to know this information about you if situations were reversed? Okay, and that simply summarizes confidentiality in caregiving. So I would then proceed to advanced directives in caregiving. So, by way of introduction, advanced directives are legal documents that allow a person to choose the type of medical care that they wish to receive should they become unable to state their choices and make decisions in the future. So advanced directive could be given by an 80-year-old for should any situation happens that he or she becomes unconscious or cognitively impaired to be able to make decisions. So they then give advanced directive as to how they want to be cared for. It's a legal document. It tells the healthcare provider, you inclusive, the type of treatment your patient would want to have and does not want to receive. When they get to that where they can make a cognitively informed decision for themselves. So this also allows your patient to select individuals to make decisions for them should they become unable to do so. So some people can select their child to make such decision or a spouse to make such decision for them. Living wills are a type of an advanced directive. It explains of medical care patients will want to have and the ones they do not want to have should they become unable to make such decisions for themselves in the future. So a living will is not the same as the last will or testament. A last will and the testament is a legal document that delegates a person to be an executor of their estate and explains how a person wishes to have their property and possessions disposed of after their death. So will this is the last will, but the living will is as regards healthcare received or to be received by a patient. So a living will is only about medical care and treatment. So examples of what a person may include in their living will are the decisions about being artificially fed through a vein or the stomach, having a tube inserted down their throat for mechanical ventilation if they are not able to breathe unaided, It could include decisions as regards cardiopulmonary resuscitation. Should they have a cardiac arrest? Do they want to be resuscitated or they should be left? It could involve decisions around blood transfusions. Jehovah's Witnesses many times would even give such an advanced directive as to not be transfused should they become cognitively impaired to make such decisions. Then it would also include things as to whether they want to be dialyzed or not. Now, there's another entity called healthcare by proxy. So it's a durable power of attorney for healthcare. A healthcare proxy is someone who the patient delegates to make decision for them in the future should they be unable to do so. It's a type of advanced directive. It's not the same as an executor of a will. A person can have one person as the executor of their will and choose a different person as their healthcare proxy if they choose. A healthcare proxy can make decisions for the patient's healthcare if the patient is unable to do so. The healthcare proxy is responsible for carrying out the patient's wish and for following the living will. So that's the person that is responsible to see that what this individual has written as their advanced directive gets carried out to the letter. Now, if the patient has not made a living will, the healthcare proxy is responsible for making decisions on behalf of the patient according to what they believe is in the best interest of these patients. Now, some patients would also leave a DNR in their living will. DNR means to not resuscitate. It's also another type of advanced directive. It means a decision not to receive cardiopulmonary resuscitation should they have a cardiac arrest or any need for such. It means that the patient if he stops beating or the patient stops breathing, the healthcare providers are not allowed to perform CPR. A do not resuscitate order is an order written by a physician after the patient has discussed their wishes with their doctor. If the patient has a do not resuscitate order and a healthcare provider performs CPR, knowing that there is a do not resuscitate order, legal consequences can occur against the healthcare provider. Even if the person does wake up after the CPR and did not die, the fact that the person ignored the DNR, the person is at risk of legal consequence. So it's important to know whether your patient has a DNR order in place before you begin to implement CPR, especially for very old ones who you know may have given an advanced directive. So you want to ask before you start your CPR, this individual, my patient, did he or she give a DNR order in place? Now, having a DNR order does not affect other treatments the patient receives. This means that the patient can still continue to receive treatments such as medication, surgery, physical therapy, and other medical intervention. The only place you draw the line is in CPR. A DNR applies only whether or not your patient would like CPR performed should their heart stop or if they stop breathing. So a healthcare proxy of the family member cannot have a DNR order removed. If your patient has said it, it has said. So there's no sentiment, the relative coming later. Please do CPR. Let's see if we can bring this patient back around again. And this means that even the patient's healthcare proxy cannot revoke that order. There are some orders that are unrevocable once the patient becomes comatose or an advanced directive of DNR. Okay, and with that, we come to the end of this presentation. And as always, thank you for staying with me. And I wish you the wonderful